Dumelani sanibonani molweni emakhaya aninjani okwanamhlanje igama lami nguConstance unothando kamathe siku straight talk on sex work whereby we unpack and discuss the issues that are faced by the sex workers in the industry. And we are mainly focusing on the policies and the labor policies that are affecting the industry, which is the criminalization. So today in our talk show, our topic will be talking about the lack of the healthy access to the sex work industry. When the sex workers are trying to access these services, they are totally denied and discriminated because of their profession. So today in our episode, we're gonna have a wonderful guest in. Her name is Nomsa Maqwabi. Nomsa Maqwabi, she's gonna take us through in this discussion today. Nomsa, welcome to Cape Town TV.
Thank you very much for having me.
Thank you, Nomsa. Thank you for accepting to be here today, and you are more than welcome.
Okay.
So today our topic, as I mentioned earlier to you, we'll be talking about the healthy care. So I just want you to firstly unpack it for me when we are talking about the healthy care. What comes into your mind? What is the meaning of the healthy care?
Healthcare services or facilities, I think it is a place whereby everybody should be treated equal. Whoever goes seeking for health, medical assistance should be accepted. It doesn't matter what kind of profession they do, but it is a place whereby everybody should be treated equally.
That's true. I like that thing that everyone must be treated equally. And then tell us more about the current situation, because I have read the newspaper and I see the articles where the sex workers are complaining that are being discriminated and denied the services. What is happening? What is the current situation?
The problem I think that we as sex workers are facing when it comes to the health facilities is the stigma because of criminalization of sex work. So the stigma, you go to the clinic, everybody knows that you're a sex worker, so you will not be, services will not be given unto you accordingly or the way that it is expected to be. So it is very, very, very sad and heartbreaking that our fellow sisters, they end up dying because of the fear that when they go to clinic, they will be stigmatized, they will be treated, they will be called names. And at the end of the day, now you go for your ARVs, and they find out that you're a sex worker, and then that will be a problem. And before you get assisted, they will give you a lecture, not even in the private room, but in front of everyone. And also sex workers' status, HIV status are being disclosed, not by themselves, by the healthcare workers. So it is a very heartbreaking thing for us as sex workers that decriminalization, I think it is a cause of all these things. What is happening, the stigma that is happening that sex workers are facing in the communities, in the health departments, it is because of sex worker. It is still criminalized in South Africa. Yes.
Yeah, I can see that the criminalization, because in the previous week, what we discussed about, the word criminalization pop out several times, which each and every guest that we have keep on complaining about this criminalization that affected the industry. Okay, so my next question I just want to ask you, the discrimination that we are talking about, have you ever faced any kind of discrimination when you visited the health facilities, or anything that the profession have, the professionals have treat you in a certain manner that you didn't like?
There were once I went to a clinic where close to my area where I stay, and I got there because they know that she's a sex worker. So you get to the clinic, and then now the sister in charge, and that was during the time of COVID. Going there because I had some health issues that I needed medical assistance. So got there. And now remember the time of COVID, you have to wait outside. It was only a certain number that was allowed to go inside. So we were outside. So now the sister, the matron, or the sister in charge of the clinic from the area where I come from, she kind of had an attitude against me.
Yes.
Because she had some knowledge about me that this is a sex worker. So the treatment I did not like. Because instead of attending to, because I was the next person in the on the line, instead of her helping me, she just said, okay, son, can you wait on the side? And then she helped the person that was after me. So I felt really sad, and it felt like we are less of humans.
Discriminated, like
Yes.
the status of your profession.
The status of my profession, yes.
Yeah, that's terrible. Anyway, to just ask you, I wanted to find out something from you. When it happened, that kind of an incident, what step did you take? Did you do something about it? Did you try to call her out and try to address the issue, like, why are you doing this to me?
She helped the person was after me, and then the second person, the third person. And then when she called the third person, that's when I spoke up and then I asked her, say, I mean, I was here before these people, and you have not called me to ask me if what am I here for? So you just ignoring me, putting me aside, why? And there was no response. And then she said to me, if you feel like you can lay a complaint, you can write your complaint and put in the box. And then she said, because you know what you're doing.
Oh, no.
So that it goes back to the fact of they know that sex work in South Africa, it is still criminalized. So they know that you're going to lay complaint to who and say, why did they treat you? What was the reasons behind her treating you in that manner? Because now you'll have to come up and say, I was treated in this manner because I am a sex worker, and in South Africa that is a criminal offense. You will get arrested. So at the end of the day, then I felt like, you know what, let me rather just go back home.
Sure.
And then I just went home, and then I had to go to see a private doctor. And that was the only thing that I could do, because I knew that was a battle that I will not win. For that day, beside me not feeling well, and also have to address such an issue. Yes.
Okay. Yeah, Nomsa, that was a difficult time for you, because to not have an assistance in that kind of condition and your health condition is difficult. But anyway, thank you for sharing with us and to share this kind of view, so that the people out there can understand what is happening in the sex industry. To all the viewers, thank you for those who log in, and those who still want to join us. We are coming after the break. We are still on Straight Talk on Sex Work, and our topic today is healthcare and the health service, practice services that we are accessing for the sex workers. Please join us after the break. Don't go away. Thank you. Welcome back here. My name is Constance Notando Mateo on Straight Talk on Sex Work. Today, our topic, we are talking about the health care and the health services that the sex workers are failing to access in our public hospital in our public institute. So we are here with our special guest, Nomsa, who is trying to unpack and let us understand that they don't have that kind of access. And what are the causes of these blockages for them to access these services? Nomsa, welcome back again.
Thank you.
Thank you for staying with us today. Earlier, before you just shared your story about you lacking the services of the health services. So I just want to know, as we move forward, during the COVID-19, how was it for you?
During the time of COVID-19, it was, I believe that the time was difficult for everyone, whether you're a sex worker or not. But the time, it was a very difficult time for everyone. And on the process, we lost this fellow sisters, fellow colleagues that we were on this journey together because of not being able to access health facilities. And remember, we were working with a certain number of people per day. So if you don't make it, like you're from a location, you have to wake up around about 4 o'clock to go and stand on the line to go into the clinic or hospital, wherever you're going. So it was a very, very, very difficult time. Yes.
So I saw in the other community, people managed to have the kind of the mobile clinics. Yes, those mobile clinics, were they all accommodating the sex workers, or they were just accommodating certain people, or everyone was able to access the services of the mobile clinics?
The mobile clinics, I think for sex workers, they are like a home. Because we at times, if we can't don't have the access to clinics and hospitals, the only place that we run to it is these mobile clinics. Because we know that they are from the NGOs, like this organization about TB Care, you see. So I mean, we go to a place where we know that there will be no discrimination. I don't want to lie. When it comes to mobile clinics, there is no discrimination. They know you are a sex worker, you are not. And the good thing about this mobile clinic, they do not only help sex workers. Whether you're a sex worker or not, it accommodates everyone that goes to them.
Yeah, that's a beautiful thing. I just want to find out about discrimination. So the discrimination, the stigma and discrimination, since the sex work industry is totally discriminated by our society, our communities, could be the cause that also the healthy care, they are the healthy care people, they use it as an excuse to discriminate you, or it's just because they choose to be ignorant?
I think they choose to be ignorant. I think they choose to be ignorant because the problem with the Department of Health, or with the staff from Department of Health, is that they forget the oath that they have taken, that they swear that they will serve the community, they will serve the people. It doesn't matter who you are, but they fail to understand that oath that they take. And the problem that we are having now, it does not start in the clinics. These are people that we live with them in the community. These people, they know us back home. We grow up, some of them will grow up in front of them, some of them we went to school with their kids, some of them, they are our relatives. So now when they go to a place of work, with the information that they have with you, they forget that they are in the place of work, they're in the place of duty, and they have a commitment to serve the community. So when they get there, the things that they know about you, instead of doing what they are there, the purpose that they are put there to serve, they forget that, and then they start bringing out those things. So I feel that people are ignorant.
They are ignorant.
Ignorant. That is what is causing now this discrimination, because if you do not understand something, you do not understand my profession, try to call me aside and try to find out what is this all about? What are the reasons pushing you to do this?
Okay. Yeah. And then you just tell me a little bit about the criminalization. Do you think because they are using this power, they have this powerful law that is criminalization? And then ngiyawucaphukela lo mthetho ukuthethe iqiniso. Ngifuna ukwazi ukuthi maybe it's because criminalization ikhona in the picture ukuthi ama-sex workers they are criminalized, then nathi masithatha ama-chances because lo mthetho ukhona, uyabo? So nanku uyavela le treatment esiyenza ama-sex workers, where will they run to since criminalization ikhona? Ukuthi kungaba yile reason enye.
I think that is criminalization is what motivates them to do what they do, because they know that they can do whatever they want to do and you have nowhere to run to. You have nowhere to run to. So now they found criminalization as a weapon that they can. Criminalization is a weapon that they can do all these things, because they know that Lona, she's a criminal. There is nowhere that she can go to. There is no place she can run to.
Okay.
Yes.
All right, Nomsa ngiyabonga kakhulu. I hope nabalaleli balalele ukubana what is happening in the sex trade nama health care to access the services kuyinto eyi-challenge enkulu enganani, and how does it affect i-sex worker? Discriminating the sex workers, it doesn't take you anywhere as a country, because remember we are facing the challenges of the pandemic and HIV. Kodwa ke siyabatlonta sithi yibo abaspreada i-HIV. Did you hear from Nomsa ukuthi how are they discriminated and rejected by us as community and the health care? So think about it. My question is to you out there. Please go to our Facebook page. I'm posing a question. Think about and put your comment on our social media and say what you think about the criminalization and the health of the sex workers. Right now, please, I'm going to put my insight so that you can understand what is happening on the ground. Thank you so much for staying with us this evening. So I would like to say, please follow us on our social media on Straight Talk on Sex Working, where we unpack the issues and the challenges that the sex workers are facing. And also you need to understand that these issues, where are they leading us as a country? Today I have a wonderful guest, Nomsa Qabi. Nomsa Qabi has been taking us the issue of the healthy care and the facilities that the sex workers are facing. Nomsa, welcome back again.
Thank you.
My question to you now, I just want you to pick about the laws that have been implemented. We know we have the criminalization that totally doesn't work for sex workers. But there is something that I always hear people mentioning, and I have seen on the research that has been done before. Tell me about condom using as an evidence. The police using condoms as an evidence. How can a condom become an evidence?
We have all these organizations like Swed and Sisonke. What we do is educate the sex workers to practice safe sex. And there is this thing that sex workers are the spreaders of HIV and AIDS. But if we look at the statistics, if the sex workers, we have a very less number of sex workers who are infected. There is no such a thing. We are not HIV spreaders. we make sure that we practice the safe sex at all times. But now the problem is this now. You'll go to the clinic, to the day hospital to get condoms, yes, and then you go to do your work. The next thing is that law enforcement, police will come, and then they catch you with condoms.
Yes.
And whether what I know is that if you are caught in the act, then you
it proves that you are a sex worker.
Yes, it proves.
Yes.
But now sex workers are being harassed by law enforcement and police. They will arrest them, they catch them, they find them with maybe with 10 condoms in your bag. You already committed an offense. They get arrested. Some of the sex workers, they will find them with their pills, ARVs in their bags. They will also take those as they will get arrested, get these ridiculous fines because of you were in possession of a condom. That it is the right of everyone to have access to a condom. It doesn't matter whether you're a sex worker or not, you can have a condom. It is your right as a person. So it is said that we will get condoms and all these things, but these things that are there to help us, they serve to also, they were there to help us to protect ourselves. So we end up being arrested because that was found as a proof or as an evidence.
As an evidence. Okay. That's so difficult. So just a quick question to you, and this is my last question. I just want to find out from you, what changes do you think the Department of Health needs to change?
As Usisonke, there were sensitization trainings that were done, like with the other department, with Department of Health, with Department of Police, Department of Justice. I think that if those trainings should be conducted with the Department of Health, that will help. Because lack of knowledge, it says people perish for the lack of knowledge.
Yes.
And things are not being done accordingly because people do not have knowledge. And they think that sex work, it is only exchanging of sex only. But the sex work industry, it is a very huge industry. We've got strippers, we've got modelers, but so it is only seen on the one side. So I think what it needs to be done, even on the Department of Health curriculum, it should be included that the trainings like that should be conducted. And we know that sex work is still criminalized in South Africa, and we know that for now that we have not gotten decriminalization, some of the things cannot be put down and say, okay, these are the things that these are what the rules that should be followed. So I think that once we get decriminalization, everything will change. But for now, we need trainings, we need sensitization. Department of Health needs to be sensitized about sex work.
Okay. I thank you so much, Nomsa. That was very informative. It was sharing Zona today and using your experience. That is so powerful. And thank you very much for joining us to the studio today. As I said to you out there, we don't talk what we don't know. Nomsa, she's here to unpack us, and many others are still coming to unpack us and understand the sex work industry. On the Straight Talk, we talk about these issues and the people who are living and surviving in the industry. These are the people that they unpack these stories so that you can understand. So please, regarding in issues of the health, you heard from Nomsa. Ayiyo ni sex worker spread HIV and STI and TB. Department of Justice, they use the condom as an evidence to think about that, and where does this take the sex worker to? It's a question that I'm posing as I'm closing the show today, and say, comment on our Facebook page and follow us on Twitter, and then you'll catch up more stories and comments about that. Thank you so much for joining me today.